Hey everyone, this is Melissa Kay, and this is Occupational Therapy 226, OT with Children. Today what we're going to be looking at is the feeding competency, and there are 4 different skills that I'm going to be showing you and demoing, and you will be responsible for learning these and then demonstrating your knowledge once you've had a chance to practice, ask questions, etc. I'm here with Maddie today, who's just graciously agreed to help me out. And we want to keep in mind that even though Maddie is a grown-up, we're going to be working with children, right? So you'll have to use your imagination just a little bit. We're going to look at 4 skills. The first one is tongue lateralization, and that is to wake up the tongue in the mouth so that the child is more able to do some of the subsequent skills. The second will be feeding the child with a spoon with some facilitation to help with jaw closure. And the third will be drinking from a cup, again with some facilitation for lip closure and to help close the jaw for swallowing and transit of the fluid. And then the final one will be feeding the child a cracker or other dissolvable item and helping them to chew. So let's go ahead and get started. I'll run through it with a lot of explanation and slowly, and then we'll run through it again with me doing what I would do if I was in an actual clinical situation. All right, so the first thing we want to do, and this is easy to overlook if you're feeling nervous or if you feel like you're on the spot, is to set up your area. So we're going to have a look at that and how you need to set up so that everything is safe and easily accessible. All right, so the first thing that we need to do before we even start working with our client is to set up our area. That's actually going to start before you even get to the table. You're going to go and wash your hands thoroughly. You will also take a minute to get yourself centered. If something's happened outside of the clinic or the hospital, you're going to let that go so that you can be fully present. And this setup time is a great time to do that. All right, so you've done that, and for this demo, I'm not going to be wearing gloves just so that you can see everything much more clearly, but generally you would be wearing gloves and you would have them set up as well. So we can never be sure that any surface is clean or sanitary, so we're always going to put out paper towel or some other sanitary surface underneath our supplies. Then I put out my tongue blade, which we're going to be using for lateralizing the tongue to prepare the mouth and the tongue for eating and drinking. I have my spoon. Since Maddie is a grown-up, we get a regular spoon, but if she was a child, we may use a much smaller spoon or an adapted spoon. We have our cup with water. We're using a transparent cup, which makes it super easy to see what's going on. You may not have that, in which case you'll be adjusting your view of the cup while you're helping your client to drink. And then some easily dissolvable food like graham crackers, saltines, things like that. And today we have cinnamon grahams. All right, so you get everything on your surface. Make sure that it's close to where you want to be, and you're going to assume that the setup is the start of your session, right? It can be easy to forget that when you're nervous or you're really focused on your client, but you need that setup. Then work with the client, and finally, the end is clean everything up, put it all together, dispose of it safely, right? So we can't overestimate the importance of sanitary conditions while we're working on feeding. The first thing we're going to do is make sure that the client is in an appropriate and safe position for working on feeding and drinking. So to do that, I'm going to have you actually exaggerate an unsafe position. We want the client to be in a 90-90-90 position. So what does that mean? Well, at the hips, we're going to want a 90-degree angle. At the knees and at the ankles. Now, with kids, it can be tempting to just sort of like move them around to get them in position, but we don't want to do that. We want to help them or facilitate them getting into an appropriate position. So I might ask Maddie to sit up straight and then put your bottom back against the back of the chair. That's great, and you can lean back now. And then I'm going to have you uncross your legs. And notice that I tell her to uncross her legs, but I'm also giving her some tactile cues, right, or kinesthetic cues. And then we're going to put her feet right under her knees. So in effect, we have 90 degrees from the torso to the hips, 90 degrees from the femur down to the calves, and 90 degrees from the calves to the feet. So 90 at the hips, 90 at the knees, 90 at the ankles. The one other thing we want to be sure of is that there is a slight chin tuck. Now, we don't want a chin tuck that's super deep, and if you do that at home right now, you can feel that there's some tightness in your neck and tightness in your swallowing mechanisms. So you don't want that. You just want a slight little chin tuck, okay? And that is to keep her in a position where the food is not going to accidentally go down, where she's not going to swallow fluids that she doesn't want to swallow. So we keep her in that position. I want you to try one other thing, which is to put your head all the way back. So if the head's back and imagine that you're drinking something, you have basically no control over how fast it's going down or when it's going down. It's basically like an open pipe, right? So we keep this safe, slight chin tuck position. Sometimes when we're working on feeding, that chin tuck goes away because we're working with the face and we kind of push the head back. So we want to resume that position afterwards. All right, ready to get started. So the first thing we're going to do is work with the tongue blade, and with any kind of medical equipment that comes wrapped, you want to unwrap it without touching it, just to keep it clean and sanitary. So I just bend back the wrapping. And then what I'm going to be doing is giving each side of her tongue 3 quick thrusts. And they look like little pushes like this, okay? Things we want to avoid are scraping against the teeth, doing it too hard, doing it too soft, or in any way kind of distorting the edges of her mouth. So it's going to look like this. At this point, I'll also tell you that how we're going to facilitate is by using the non-dominant hand. So I'm left-handed. I'll use my right hand to facilitate her jaw movement. We call it jaw control, but it's not really control because you're just facilitating. You're just helping. And so the thumb goes on the chin, the index finger goes along the jaw, and the 3 middle ring and pinky fingers curl up and they go under the suprahyoids. So it looks like this, okay? And then we can open, close, open, close. So it's giving us a bunch of control over how wide she's open, when she closes her mouth, etc. So we're going to open, and then I insert the tongue blade and I go 1, 2, 3. Pull out, go in the other side, 1, 2, 3. Where I'm going is on the lateral side of her tongue. So this quick stretch is going to activate the extrinsic muscles of the tongue and prepare, along with a bunch of other techniques or exercises that one might use when working on feeding, to prepare for feeding, to wake the tongue up, wake the mouth up. All right, so now we're going to get started with feeding with a spoon. So tongue blade, number 1, feeding with a spoon, number 2. So we're going to grasp a spoon, and I'm actually sitting really close to her. Now, this position, if you're not used to it, feels intimate. It feels super close. I actually have my knee against her thigh, and that's something that you get used to over time. It actually is kind of comforting for the person, right? So we're working around their face and their mouth, and it's pretty vulnerable to have somebody in your mouth. So I keep this leg here. I might also, if it's a little kid, keep another foot here, just so that I'm in contact and I have a bunch of control in a comfortable way. Depending on your size and the size of your client, you're going to need to adjust those angles and how you're interacting with the client. I'm not coming straight on because that's it's pretty confrontational. And again, when we're talking about feeding, it's vulnerable. You know, having somebody in your mouth is a big deal. So I'm off to the side a little bit just to ensure that that I'm acting respectfully and I'm entering her space instead of barging in. All right, and I'm waving around with a spoon. All right, so here we go. So first thing, we're gonna put thumb, index finger, other three fingers are curled under the suprahyoids. I open her mouth. I'm gonna insert the spoon on the side of her mouth and close her jaw and pull out at a oblique angle or a diagonal angle. So let's look at it one more time. So open, insert the spoon on the side, close, pull out. So in effect, if we had food on the spoon, what we're doing is we're helping to close the jaw, helping to clear the spoon of food and pulling it out to the side so that we avoid triggering any adverse responses from like scraping on the front teeth or things like that. Okay, so that's number 2. Number 3 is having a drink of water. Students love and hate this one the most, right?
Yeah, definitely.
Yeah. All right, so what we're aiming for is to help Maddie close her jaw and also help the excursion of the water from the front of her mouth down her throat, right? So again, 90, 90, 90, we're gonna be really careful about the slight chin tuck with this one because water, being a thin liquid, is the toughest thing for any client to swallow because there's not a lot of resistance, right? So it's hard to control. All right, so again, I position, I open her mouth, and with this one, I brace the cup on her lip. I start to pour, and I've moved my fingers over. So maybe we can just turn your head. So I've gone from this position to this position. So this position is helping me purse her lips or give her lip closure, and I'm still able to keep my fingers facilitating her jaw closure. So let's take a look at it one more time. All right, so this is the sequence. Cup on the lip, I slide my hand, I give her a little sip, and now I'm pushing up on her suprahyoids to close her jaw. And I'm giving just a little bit of a kissy face smooch with my fingers. And that's drinking. All right. Last one, what we're gonna do is we're gonna break off a piece of cracker, and it always breaks in a weird way when you want it to be nice and neat and everything. All right, so what I have is a piece of cracker that is kind of long and skinny. This is because we're going to insert the cracker, so imagine the molars and then the cheek and that little space in between. That's where we're gonna put the cracker, and then I'm gonna help her chew it. So she's gonna take 3 little bites. So again, position, and I know this is sounding redundant now, but if you can get my voice in your head of position the thumb on the chin, position the finger along the jaw, position the 3 remaining fingers on the suprahyoids. Then I open her mouth, I sneak the cracker in, and we go 1, 2, 3. And then if need be, I can help her chew. Okay, one more time for that one. Do you need water?
No, I'm okay.
Okay.
Thank you.
All right. So open and bite, bite, bite. Great. All right, you're a very good eater.
Thank you. I like food.
Me too. All right, so now what I'm going to do is go through it one more time. So you can fast forward and rewind however you want, but I'm going to go through it as if she was a kid, right? One thing that I find that students do, which is part of your developmental learning process, is you want to talk the client through everything you're doing. And for some people that's fine, especially grown-ups, but for kids, number one, they tend not to get it, especially if they're little. 2, 3-year-olds, they don't know about 90, 90, 90. They're not certain about what suprahyoids are or any of that. And so we're going to change the language around it. And if you need to talk out loud, that's fine, but talk out loud in your head, right? So what we're sharing with the client is really some very basic directions. Okay. So why don't you go into a terrible position again? Okay. Hey, Maddie.
Hi.
We're going to do some feeding today, okay?
Good.
All right. So first thing I need you to do is sit up real straight. And go ahead and push your bottom back against the chair. Excellent. Okay, can you uncross your legs for me? Thanks. All right, let's have your feet flat on the floor. That looks great. Are you comfy? Mm-hmm. Okay, great. We're going to start off, we're going to play an exercise game with your tongue, okay? All right, here we go. I'm going to open your mouth, and we're going to go 1, 2, 3. 1, 2, 3. Okay, let's do it one more time. This time you push back, okay? Make your tongue super strong. 1, 2, 3. That's awesome. 1, 2, 3. Good job. Okay. Now we're going to feed you a little bit of pudding, okay? All right. I'm going to open your mouth, and here we go. Good job. All right. Let's have one more bite. You ready for a drink of water?
Mm-hmm.
Okay. Okay, I'm going to help you close your lips. Nice swallowing. Okay, and do you like graham crackers? Mm-hmm. These are cinnamon ones. I know, right? I do too. Okay, let's open and bite, bite, bite. Okay, keep chewing. Awesome. Nice job. All right, so in real life, you would be doing an entire regimen of feeding. You might not feed and drink and tongue blade and graham crackers all at the same time, but this gives you an idea of how various techniques for feeding go. I do want to say that feeding is an advanced practice certification, so after you graduate, after you've been out in the field, you may decide that you want to go into feeding, either with adults or kids, and we have advanced certification in that. So at the end of your competency, you're not an expert at feeding, you're a beginner at feeding, but you have a much better idea of how this process works, how to approach it, and along with the lectures about the anatomy and physiology of eating and swallowing, you'll have a good solid foundation. We'll be talking about this in class, and you'll have ample opportunities to ask questions. So please jot down anything that is unclear to you, and I will see you in class. Thank you so much for helping out. I really appreciate it.
No problem.
All right, everyone. Bye-bye.